I'm Alan Dale from Gale Force. It's an absolute pleasure to be here at the big raise for the Healthcare Foundation. Right here at beautiful Jag Hotel, talking to some folks that are really having a great time here tonight, all for a great cause. Sir, why don't you introduce yourself? Tell us what you do.
My name is Barter. I'm an emergency physician. I've been practicing in emergency medicine for 45 years now.
Wow.
And I'm currently the clinical chief of emergency medicine in the city of St. John's, and I'm the clinical lead for emergency medicine for our strategic health network across the province.
Wow. Doctor, 4.5 decades in healthcare on the front line. Talk to me about the importance of technology at this particular moment in healthcare.
I really think technology is, I mean, what I've seen in my lifetime, in my career, it's quite incredible what we do now compared to when I started. You know, it's really great because technology enhances what we've got here and what we got here. Because we were trained to use this and we were trained to use these. And now we've got technology to enhance that and we can do better. And I think every day we learn more and more the appropriate use of technology, investigation-wise, PET scans, MRIs, CTs. We didn't have any of that when I started out, right? We were lucky to get an X-ray and a bit of blood work.
Yeah. It must be a direct result in patient care.
Sorry, ask that question again.
It must be a direct result to patient care. So patients must benefit from this increase in technology.
Yeah, I definitely think that's true. We have to be careful with technology. We mustn't stop using our brains and just rely on technology. I think that we've over the years we've written some really good, solid clinical guidelines in how to investigate patients. The kind of technology we've seen here tonight for the surgical robotic surgery, that's a technique. It's not. I mean, it's fantastic in terms of performing the surgery, making the right move, making the right cut, putting the stitch in the right place. But then there's the other kind of technology that's involved in investigating the patient. And we've got to combine that with what we call medical practice.
You know, it's exciting to watch all of these pieces come together, right? And watch our society grow with technology in the middle of it. And it's really so vitally important in your field. You got to get it right.
Yeah. So it's interesting you should say that because as I think we talked about a year ago, we are actually currently building a brand new ED at the Health Science Center, and then we are going to redevelop and remodel our current ED. So we're going to have a pretty state-of-the-art emergency department by the end of 2026, 2027, with a lot of technical improvements. Which obviously with a new health information system coming to Newfoundland, it's going to be driven by that. We're also putting in something called the black box technology, which is very akin to a black box on an airplane.
Okay.
We'll be putting in our trauma base so that we'll actually video and audio transcribe everything that happens there, and we will use that constructively, not destructively, not to criticize people, but to improve our performance.
What an incredible thing. Of course, all of that doesn't happen, of course, without these type of events. People leaning in and helping and then putting fuel into this incredible system. Talk to me about the importance of these events.
Yeah, so we wouldn't be able to do an awful lot of what we do. I'll give you an example. We're very, very aware these days of the older adult population, and they're having to come to places like emergency department for care, which maybe not be the most appropriate place, but it's the only place. So we're trying to make our emergency departments gerry friendly. And have equipment there that is appropriate for older adults and make life easier for them whilst they're there. And that takes money.
Right.
And the Healthcare Foundation has helped us tremendously with that kind of money. And then we're using bedside ultrasounds. We're using scanners that we've never used before. Again, the Healthcare Corporation or the Healthcare Foundation has helped us with that. We couldn't do those little extras without them.
Yeah. And doctor, we're doing it in a fun way. We're raising money
Yeah.
today. Isn't that fantastic?
Yeah.
Such an important topic, such a complicated thing to get our head around. We're having fun doing it.
Yeah, and everybody in this room here tonight is giving back. They understand the need, they understand the necessity, and God bless them all, because we wouldn't be as far as we are without them.
Doctor, thank you very much for what you do on the front lines every day. Have a bit of fun out there. And
Yeah.
Thanks for contributing in every single way that you do. Thank you.
Thank you so much.